Karibu and welcome to lesson 1 of the MTTI caregiver course. In the next 5 minutes, we will learn what a caregiver actually does, why the role matters, and very importantly, where the caregiver's job ends and where the nurse's or doctor's job begins. This first lesson is the map before the journey. Let us begin. Before we begin, let us take 1 minute to see the full picture. Your caregiver course, CAG-01, is built from 10 lessons that mirror the TVET CDACC Caregiving Level 4 curriculum. You will study housekeeping services, client dietary interventions, psychosocial care, first aid services, caregiving catering services, special needs care support, and for those planning to work abroad, the full pre-departure process. Every lesson has 3 parts: this video, a hands-on interactive lab, and a graded quiz. Complete all 10 with 70% or higher, and you receive your MTTI online certificate of completion. Or, if you choose, you may sit the physical CDACC national exam in Kenya for the full national certificate. Every lesson has 3 parts in this order. Part 1, this short video, where the concepts are explained with a real Kenyan care setting. Part 2, an interactive lesson in your browser where you click, drag, and choose your way through the practical decisions. And Part 3, a quiz at the end to check what you have learned. If you are watching this on YouTube, welcome! You are seeing Part 1. Parts 2 and 3 are available when you enroll at masomotele.co.ke. Meet Njeri Wanjiru. Njeri is a young Kenyan who has just enrolled at MTTI to become a certified caregiver. Today is her very first day of practical training. She is shadowing an experienced caregiver at the home of Bibi Achieng, an 82-year-old grandmother in Kisumu who is recovering from a mild stroke. Bibi Achieng needs help with almost everything: washing, dressing, meals, mobility, and quietly, company. By the end of this lesson, Njeri and you will know exactly what a caregiver's role involves in a home like this one. A caregiver's work is varied, and it is built around one person, the client, and their changing needs. 6 areas cover almost everything. 1. Personal and household care: bathing, dressing, cleaning, laundry. 2. Health monitoring and reporting: noticing changes and telling the nurse. 3. Dietary support: cooking, feeding, watching for tolerance. 4. Mobility assistance: safe transfers, walking support, falls prevention. 5. Emotional and psychosocial support: listening, comforting, sitting with someone through a difficult moment. And 6. Companionship: the simple, powerful presence of another person. Every unit later in this course builds one of these pieces in depth. Why does the world need trained caregivers? Populations are aging, families are smaller, and many family members work far from home. Chronic illness is more common, and modern medicines keep people alive longer, but often with more support needs. Done well, caregiving protects a client's dignity, safety, and quality of life at a very vulnerable time. It is also a joining career, with real employment at home in Kenya and real opportunities abroad, in the Gulf, Europe, North America, and Asia. Trained certified caregivers earn more and are respected. Here is the most important principle in this whole course. A caregiver's job is to observe, to support, and to refer. It is not to diagnose conditions. It is not to prescribe medicines. It is not to make treatment decisions. When Bibi Achieng seems unwell, Njeri notices, records what she sees, and calls the nurse. She does not guess. She does not act alone. Recognizing this boundary early protects both the caregiver and the client. It is a principle you will see applied again and again in first aid, in dietary care, in psychosocial support, in special needs. Whenever you are in doubt, the safest, most professional response as a caregiver is 3 simple actions. Notice it, record it in the client's care notes with the date and time, tell someone qualified, the family nurse, the visiting doctor, the supervisor. Never guess, never act on a hunch. This one habit will keep every client you ever look after safe, and it will keep your professional record clean. So, back to Njeri. On her first day at Bibi Achieng's home, Njeri does 5 things. She introduces herself warmly, sits at eye level, and asks Bibi how she likes her tea. She shadows the senior caregiver through morning care, the wash, the dressing, the breakfast. She observes Bibi's mood, appetite, breathing, and skin, and writes it all down. She practices safe transfer from the bed to chair. And when Bibi mentions a small pain in her chest, Njeri does not try to explain it away. She writes it down and she tells the visiting nurse straight away. That, in one day, is the caregiver role in action. Complete the whole MTTI caregiver course and you have 2 certification options. Option A, the MTTI online certificate of completion, fully online, no travel, TVET registered institution, included in your course fee. Option B, the full TVET CDACC national certificate, the government issued Kenya national TVET certificate. This one requires physical attendance at CDACC Assessment Center in Kenya and extra CDACC fees payable per current guidelines. You can start with option A, take up a better care contract, then upgrade to option B on your next visit to Kenya. So, that is the caregiver role in one lesson. 6 areas of work, 1 firm boundary. Observe, support, refer. 1 safe habit. Notice, record, tell. In our next lesson, 1.2, we begin the first practical unit, housekeeping services. We will follow Njeri as she prepares Bibi Achieng's room, changes the bed, and sets up a clean, safe home environment. See you there. Karibu tena. Welcome back.